Yeah, my presentation will concentrate on structures and processes to meet challenges that occur when we try to find solutions across sectors. I will tell you about this current work that Diana told you about, a white paper. This is a government report to the Parliament. This is not yet launched, so I can't get into details of the policies, but I will focus on process involving five ministries and the background for the work. So I will share experiences from national policy development processes, but I think these experiences can also be relevant for cross-sectoral collaboration on all levels, really. I'll just briefly take you through a few facts on the Norwegian system for context. Norway is quite a big country, but with few people. So this means we have a lot of space, but also long distances in some areas. If you go from Oslo to the far north of Norway, it is more or less the same distance as if you go from Oslo to northern Italy. We have quite many municipalities and also 15 counties on the regional level. And local governments in Norway have significant autonomy to make decisions on local matters. They have the authority to levy taxes and manage their budgets, which allows them to tailor services to the needs of their communities. While local governments have considerable independence, they are still subject to oversight by the central government. This ensures that national standards and policies are maintained across the country, and the central government can govern the municipalities mainly through law and funding. And these municipalities differ in many ways. They have very different sizes in population size. They have different geography. Some are rural, some are cities. And the demographic composition is also different between the municipalities. Despite these differences providing various conditions for the municipalities, the same legal requirements apply to all municipalities. This creates a range of challenges for the municipalities, but also for the state, trying to steer such a heterogeneous group of municipalities. There are some common challenges that we can see across different sectors. And one common factor is that the shortage of labor is a constant problem especially in welfare services. Projections show that we will lack people in healthcare services and other essential welfare services such as kindergartens and schools. And this means that we have to work smarter and use the resources more effectively. So before we run out of money, we run out of hands. The next point is that the sectors are mutually dependent on each other to obtain their own goals. Complex challenges across sectors need comprehensive solutions. Though people are not divided into sectors, to give good services, we need to see the whole human being. Another challenge is that there is too much emphasis on fixing problems rather than preventing them. This leads to inefficient use of resources. There are several reasons for this, and it's not easy to change. And I want to give just one example. The local support system for pupils with special needs, called Pedagogical Psychological Service, has two main tasks. They must provide individual assessments to find out whether a student needs special education. The other task is to support kindergartens and schools on system level to ensure good and inclusive learning environments, where as many as possible receive the support they need within the regular provision. And the capacity of this pedagogical psychological service is overwhelmed, so they are stuck in a pattern with too many individual assessments, which takes capacity away from work at the system level, leading to the need for more individual assessments instead of preventing them. It becomes a vicious cycle. So, yeah, and this the result is that too many children experience that they get help too late or that they don't get help at all. And moreover, when they do get help, and often they will need support from different services, they too often experience uncoordinated and fragmented services, and parents often need to take the coordinating role. What do we need then? We need to put the user in the center to give comprehensive services. We need to see the whole person. In our context, this is children and young people. And for example, when a student has a problem at home, she or he will have these problems even when they're at school. It's not like these problems disappear when they're at school. Issues at home can significantly impact a student's well-being and performance at school. And the school can provide guidance and support, but the school can't fix all the problems. And it needs to cooperate with other services so that the student and the family can get comprehensive support and maybe fix the core problem. As I mentioned earlier, we need to make the most out of the resources we have, and the sectors must collaborate to better utilize the combined capacity and expertise. And we will not have enough hands if we don't. We need to identify challenges early and prevent them from growing into major problems that require extensive help. And all this is, of course, not easy. And we have obstacles in different levels. You can go to the next slide. The municipalities are responsible for most welfare services in our country, and they have duties and tasks that are established by laws and regulations, and they are largely funded through government transfers. While some improvements have been made to the legislation in recent years, including harmonizing the laws for the various welfare sectors regarding duty to cooperate with other services, it is still the case that the regulations that municipalities must adhere to are sectorized. And when it comes to funding, the main rule is that they're funded by a block grant, but the state also has many special grants that municipalities can apply for. And these grants are often targeted at special groups and issues, and they are sectorized. This also means that monitoring and reporting occurs sector-wise. And this is resource intensive for both the municipalities and the state. And divergent requirements and fragmented initiatives from the national level can pose significant challenges in governance and policy implementation. It makes it difficult to prioritize between initiatives, and the initiatives are not necessarily aligned with local needs. This situation is reinforced by a sectorized organization at local level, and the ability to collaborate across sectors at the local level can also be restrained by a lack of competence and capacity in the services. So why do we mess it up like this from the national level? Well, firstly, the state is also organized into different sectors in silos. The ministers are responsible for their respective sectors, both constitutionally and politically. Problems that shows up in one sector renders a call for action from the ministers responsible for that sector, even if the problem may be a consequence of problems in other sectors. And in a fast-paced media environment, it is often difficult to convey thorough analysis and holistic thinking. But as you can see, children are best off outside the silos. They don't fit into one of them, and they're not divided into sectors. And problems don't divide nicely into sectors either. We have to find solutions in between the sectors or silos, which brings me to the next slide. Providing children and young people with comprehensive and effective support has been a work that has been, or something that has been worked on for a long time. We have tried to address these challenges within the welfare sectors, such as education, health, etc. And we have also had projects and programs where multiple ministries and directorates have attempted to work together. So this is a long-term commitment. And in 2021, the government launched a common strategy aimed at all the ministries. It's named Good on Our Own, Best Together. One of the main pillars in the strategy is better cross-sectoral collaboration. And to follow up this strategy, there was established a set of so-called core groups. These core groups have representations from a set of ministries, and they're characterized by top-level anchoring. Those who represent the ministries are secretary generals or director generals. So it's right on the top. The groups are established to work on areas that require strategic and coordinated efforts over time, often wicked problems. And one of them is the core group of vulnerable children and young people. And through the core group structure, the ministries test new ways to collaborate and improve in coordination to ensure that their responsibilities, policies, etc., are coercive and targeted. And the aim is to collaborate on the level that is suitable for the task, often referred to as the collaboration ladder. Each step on this ladder involves tighter collaboration. And the lowest step is a good starting point, sharing information that is relevant for the other actors. And then we go through developing joint problem understanding and awareness of possible goal conflicts to developing joint plans and targets and joint policy making. The core group on vulnerable children and young people has activities on all levels of this collaboration ladder, but there has been a challenge that this structure is insufficiently connected to the political level. Thus, real joint policymaking has been difficult to obtain. So that's why the idea of a common white paper among several ministries emerged. Some of these secretary generals from the core group came together and recommended to the political leadership a joint effort against social inequality and in collaboration between several ministries. And this was applauded by the politicians, and soon the decision was made to develop a white paper together. And this was to be a joint project between 5 ministries: the Ministry of Labour and Social Inclusion, Children and Families, Health and Care Services, Culture and Equality, and Education and Research. This work required structures that ensured cooperation between the ministries and anchoring in the various ministries, as well as in a unified political leadership. So we established a project team with representatives from all ministries, a steering committee with director generals from all 5 ministries, and a group of state secretaries from all 5 ministries, the political level. And we've even had meetings with all 5 ministers a couple of times. So we all have shared responsibility in this work. None of the ministers has the leading role. We have distributed the different roles in the project on different ministries. I am the project manager from the Ministry of Education and Research. I have an assistant manager coming from the Ministry of Health and Care Services. The leader of the steering group is from the Ministry of Labour and Social Inclusion, etc. So, next slide. So, why is this paper on social equality and mobility? As I said, one of the main goals of the current government is to reduce social inequalities and ensure social mobility. And Norway is a country with less inequalities than many other countries, but it is still rising. And where you come from has too much impact on how you make it in life. And challenging living conditions are passed down to next generation. And we see that too many young people are neither in education, employment, or training, so-called needs. This has obviously severe consequences for individuals, but also means large costs and consequences for the society as a whole. The main goals of this white paper are early intervention, with a special emphasis on the first 1,000 days in a child's life, including life before birth. It is good conditions for growing up. The children must have good lives when they are children. Childhood has an intrinsic value. but it is also about giving equal possibilities for all children and young people, irrespective of social background. It is a goal also to obtain better cooperation between arenas and services aimed at children and young people. Here are some of the measures that we are discussing. I'm not going into detail on this, but we are discussing different support for families to ensure a good start in life. We are discussing measures to give better access to kindergartens and increase staff to ensure quality, better access to leisure activities for all. We have a work on common national initiatives and financing, and common research structures, and also joint programs on competence development. This white paper is to be launched this spring, so this is a sneak peek into something that is common. So finally, some lessons learned. I think that these lessons from work at the national level can be relevant for any level of the system. I'll say something about the challenges first. We have experienced that priorities hurt. We have, for example, an effort on going from many sector-oriented grants, as I was talking about earlier, tailored at different specific needs within a sector, going to a common or joint grant aimed at vulnerable children as such. And everyone agrees in theory, but in practice it's still difficult due to the need to prioritize across sectors. And it is a challenge with limited resources to prioritize work that does not manifest a direct outcome in your own sector. And each ministry also has its own cultures and logics, despite being part of the same system. And I guess that's true for all levels. And we have to make use to take time to get to know each other, both colleagues and routines. And we need to find new ways of doing things, ways that we all can live with. And I think that the positive experiences from this process is that high level anchoring makes it more effective to come to conclusions and to make decisions. And so leadership is important, and also when it comes to expectations from the leadership of an organization to the whole organization, that we should prioritize cooperation. Another thing is that structures matter. Collaboration doesn't just happen by chance. We have to have structures that makes this cooperation possible, and that you have capacity and time to actually do this collaboration. And I think that our experiences in shared leadership is quite interesting. I think it gives a shared commitment and more actual collaboration. For example, cooperation between ministries on white papers is not new, but the normal model is one responsible ministry leading the process. But then the interest in other ministries is limited. And I think that it's a key element in our project that we have a distributed and joint responsibility. Though we are always in danger of energy loss and lack of interest in processes like this. But I think that last but not least, a message can be that in collaboration processes across sectors, we must be patient, and collaboration must be practiced again and again, and to improve step by step, and come closer together through practice.